We start this morning with a resounding no from California voters.
Yeah, NBC News projects the effort to recall Governor Gavin Newsom has failed. A flood of early mail-in voting results overwhelmingly opposed the recall. Here's what the newly empowered governor said about the results last night.
I'm humbled and grateful to the millions and millions of Californians that exercise their fundamental right to vote and express themselves so overwhelmingly by rejecting the division, by rejecting the cynicism, by rejecting so much of the negativity that's defined our politics in this country over the course of so many years.
The leading Republican in the race, Larry Elder, also spoke last night. He delivered a concession but didn't back down from his new foray into politics.
Come on. Let's be gracious. Let's be gracious in defeat. And by the way, we may have lost the battle, but we are going to win the war. I have been a politician for all of 7 or 8 weeks. How am I doing? They're now hearing us in ways they never heard us before.
All right, if we've got numbers, if we've got vote count, you better believe we've got Steve Kornacki at the big board. Hi, Steve. Good morning. So tell us what happened overnight.
Yeah, good morning, Savannah. Well, I mean, you take a look at the numbers here. Not just a defeat for this recall effort. This is a landslide defeat. I think one thing to keep in mind here is the challenge for supporters of this recall was always steep in California. California is a state that Joe Biden won by almost 30 points in 2020. It's a state that Gavin Newsom, when he first got elected just 3 years ago in 2018, he carried by 25 points. So always the challenge for supporters of this recall was find voters who typically vote for Democrats, find voters who voted for Joe Biden last year, who probably even voted for Newsom in 2018, and flip them around and get them to kick out Gavin Newsom. And you could see here, they just completely failed to do that. When you look at these numbers line up so closely to what we saw in the presidential race last November. In fact, take a look at it this way. It's not quite a red-blue divide. We're using purple and orange here, but purple are the counties that voted no on the recall. Orange are the counties that voted yes on the recall. And what I'm going to do here is I'm going to flip over and show you the red-blue map for Trump-Biden. So keep your eye on that. And now I'm going to flip over. And I mean, look, it's the same counties here. The orange become red, the purple become blue. So the exact same divide, really, that prevailed sort of geographically, in a lot of ways, demographically in the presidential race last year, prevailed in this recall election. That's what Democrats were trying to do. That's why Joe Biden was in California on the eve of the election. That's why so much of Gavin Newsom's message revolved around Trump. They were just looking at this state and they were saying, hey, this is a Biden plus 30 state. This was a Newsom plus 25-point state in 2018. If voters can, be convinced to look at this election through the prism of Trump-Biden national politics, this is the divide that'll follow. And I mean, if you just look at the individual counties, it's not just that the blue counties were purple. I mean, the margins are so similar. Check this out. Riverside County, Inland Empire. This is one of the biggies. Joe Biden got 53% here last year. Right now, a few more votes to be counted. But no, the number on no is almost the exact same as the Joe Biden number here. So it's not just that the color scheme here is matching up when you look within these counties. There just isn't a lot of deviation. There are some interesting sort of stories here about some small shifts from counties, but did you see any big shifts here where places that went for Biden big suddenly went for this recall? No big dramatic shifts. This looks just like the map on the surface that we saw last year. That's what Democrats were trying to get.
Some of those numbers, it's actually quite wild when you see how similar they are.
Yeah,
and when you click
tells the story of America right now, too.
Yeah, absolutely. All right, Steve Kornacki, always great to have you with us. Thank you for kicking us off this morning.
Thanks, guys.
The coronavirus is reaching critical levels. In the South, they're seeing cases rise to levels not seen since the deadly winter waves, and hospitals are now pushed to the brink. ICU beds are running dangerously low. Nationwide, 1 in 4 hospitals are now reporting more than 95% of ICU beds filled. That's up from 1 in 5 last month. Hospitals are feeling the impact of the surge in Florida. Even though cases are declining there, just as many Floridians are testing positive for COVID now as they were in the winter before most people were eligible for the vaccine. The vaccines are a hot topic in the Sunshine State. Governor Ron DeSantis is now threatening cities and counties thousands of dollars if they impose vaccine mandates on their employees. NBC News Now correspondent Maura Barrett joins us now from Orlando in Orange County. It's one of the 3 counties and cities defying Florida's governor. So, Maura, the state's going to start enforcing this fine today. Tell us more about the governor's move and how leaders there in Orange County are responding.
Right. So, Joe, this is just another strike of defiance from Governor DeSantis against political protections when it comes to COVID-19. Basically, this can happen because of a law that he signed into effect early in this summer, saying that cities and counties, companies cannot enforce these vaccine mandates. And he's calling it a political move now that we're hearing a similar directive from the White House in just the last week. But basically what happens here is that the state of Florida can fine any company up to $5,000 per employee that would otherwise lose their job if they weren't to get vaccinated. And obviously, these counties that are putting these vaccine mandates in place have done this in an act of safety. The mayor here in Orlando defending his requirements. I want you to read a statement that I want to read you a statement that he gave to Politico. He said, "I'm not going to take actions that would adversely impact the safety of our community. Sometimes, quite frankly, I question whether the governor really sees it that way. He may say that he does, but I believe that many of the decisions he makes are purely politically motivated." The governor, though, maintains that this is something that he's doing in an act to protect Floridians' jobs. Joe?
I mean, the backdrop of all this is what we've been talking about for several weeks now in Florida. How are hospitals across the state doing there right now?
They're really suffering, Joe, and I feel like a broken record saying this, but the majority of the hospitalizations, especially in those ICUs, are among the unvaccinated. And so that's why places like Orlando, Orange County, where I am, are putting those vaccine requirements into place because they're trying to prevent that. If you take a snapshot of just the surrounding Orlando area, there's 5 hospitals that typically have up to 600 ICU beds. They're down to just 30, and in some hospitals, they're actually in the negatives when it comes to that ICU availability. And like we've been hearing endlessly from doctors working 16-hour shifts, they say they're emotionally fatigued. I want to hear from a few doctors across the state that our team spoke with.
This time around, this variant is deadlier. It is impacting the lungs quicker. It's eating away at the lungs. It's causing more problems. It's causing pneumomediastinum. It's causing pneumothoraces, and the patients are dying quicker.
These doctors really frustrated with the fact that people still remain to be unvaccinated. They're talking about how emotional it is having to bring children in to say goodbye to their parents. They're also seeing an increasing number of children and teenagers in these ICUs. So still the answer, they say, obviously, is to stay vaccinated in order to stay out of the hospital system, Joe.
All right, Maura, thanks so much.
Now, the battle over vaccine mandates is also impacting hospital services. One hospital in New York State says it will no longer deliver babies after dozens of workers resigned rather than get the vaccine.
NBC News correspondent Kristen Dahlgren has the latest.
Good morning, Joe and Savannah. Well, we have a developing story here. A New York State court has now issued a temporary restraining order blocking enforcement of the state's hospital vaccination mandate when somebody has a religious exemption. That, as this hospital here is having to pause its maternity services.
In the small town of Lowville in New York's North Country, women will soon have to go up to 50 miles away to give birth after 42 healthcare workers resigned over the state's vaccine mandate, and another 120 have still not complied.
At the end of business on the 27th, if you are not vaccinated, unfortunately, you can't work here anymore.
Already faced with a staffing shortage, the hospital is pausing its maternity services after next week and reevaluating other departments.
What does that tell you about vaccine mandates?
It works. We went from 63% in mid-August when the mandate was first announced. And now, about 4 weeks later, we are at 81%.
Nationally, COVID cases have finally started to dip, although hotspots like West Virginia and Kentucky are still rising. Today, the American Academy of Pediatrics warning cases in kids have increased exponentially. New data shows children accounted for nearly 30% of all new cases last week, though only a fraction of those led to hospitalizations.
Let us make our own decisions.
There are battle lines being drawn across the country. In Union County, North Carolina, where there is no mask mandate, the school board voted to halt contact tracing and most quarantine procedures.
The mall has a mask mandate, so I feel safer there than at school, and it should be the other way around.
While parents are split over the best strategy to protect our kids, the FDA is warning parents to not seek unapproved shots for children under 12 who remain too young to get vaccinated, saying children are not small adults, while pointing to ongoing pediatric clinical trials. A vaccine is expected to be approved by the end of the year.
And they are pointing out here that this hospital may be a good example of what we can expect from other rural hospitals as that federal vaccine mandate goes into effect. The CEO pointing out here that their vaccination rate of 81%, though, is much higher, almost double the vaccination rate here in this county. Joe and Savannah, back to you.
All right, thanks, Kristen. And let's now bring in Dr. Mario Ramirez. He's an emergency physician and the former pandemic and emerging threats coordinator under President Obama. Dr. Ramirez, good morning. Thanks, as always, for joining us. Now, I want to ask you about a lot of things that were just in Kristen's report there. Let's start with where that piece ended. Children, these concerns about them not being masked in school, not being vaccinated. So tell us just how serious are most COVID cases among children right now as we hear about this uptick in hospitalizations of young kids?
Sure, Savannah. So we need to put it in perspective. As the report before this rightly mentioned, kids make up about 30% of the total daily number of new COVID cases. But proportionally, in terms of hospitalizations and deaths, that number really hasn't moved at all during the pandemic. What we've seen is that roughly 1 to 2% of the pediatric cases cause hospitalization, and that the number of deaths that result from those hospitalizations has stayed at about the same level. Roughly, it's about 0.02%. which results in a total number of about 580 total deaths in children across the arc of the pandemic. And it's important to put that in the perspective of other risks that children face. So, for example, in 2019, there were over 3,400 pediatric deaths related to firearms. So it's important for us to sort of contextualize what that risk is compared to other things that our children face in their daily lives.
All right. Yes, important context there for sure. Now, we just saw from Kristen's reporting also, New York Hospital doesn't have the staffing to deliver babies after workers quit because of the vaccine mandate. My first question on this for you is just your reaction to that number of healthcare professionals deciding not to get the vaccine. And does that give you any concerns about vaccine hesitancy? People reading headlines like that healthcare professionals are not receiving the shot.
Well, as a healthcare professional myself, this is certainly deeply personal. And what I would say first is that I don't know the details of this, particular pushback. And I think if it really is a religious exemption, then we have to, trigger that discussion. But I will say that as healthcare providers, we have a duty not only to our patients to make sure that we're not infecting them, but also to try to set some expectation for the rest of the country. And, I think we're approaching a point where we have to be realistic. These things really just can't be reconciled anymore. If you want to take care of patients, then you have a duty to be vaccinated and make sure that we're protecting our patients. And if you don't want to do that, then we need to have a serious consideration about whether or not you should get out of the way.
And Dr. Ramirez, let me then ask you about the other side of that question there, which is the fact that, they have to stop delivering babies because of the staffing shortage. What other types of healthcare services have you seen impacted because of a staffing shortage, whether it be because employees are resigning or whether it be because of burnout or because ICUs are full, anything like that?
Well, I work down in the emergency department, and I will tell you that the biggest problem we face is increased wait times to see a physician in the ER. And I think, understandably, the story that we have heard is that it's increased COVID hospitalizations that are, driving people out of hospitals because we can't fit them in. But the truth is that the biggest problem we have are staffing shortages, because we've lost all of our nurses who have surged to other hard-hit COVID areas, or people have left the profession for other reasons, either because they are truly burnt out, or I think, folks are finding other jobs. And so what we have seen, right, is that we can no longer open certain parts of the hospitals because we don't have the nurses to staff them. And so I think if you're a patient who comes into an ER in America right now, what you will consistently see are wait times of 4, 5, sometimes even 8 or 9 hours. And that has reverberations across lots of other healthcare problems.
Absolutely. Dr. Ramirez, thank you, as always, for joining us, and thanks for what you're doing.
What was once Hurricane Nicholas is now a tropical depression, but it remains a serious threat. Heavy rains and flash flooding are still a concern throughout states along the Gulf Coast. In Louisiana, the nonstop rain is complicating an already difficult cleanup process following Ida, Category 4 hurricane that hit Louisiana just 3 weeks ago. NBC News correspondent Morgan Chesky joins us from Lake Charles, Louisiana with more. Morgan, good morning.
Yeah, Joe, good morning. And the concern here was that Nicholas would slow down, causing more rain, more flooding, and unfortunately, more stress for everyone living in this entire region. All too familiar with what these storms can do. Here in Lake Charles, nearly every home on this block still covered in those blue FEMA tarps, not from Hurricane Ida, but from Hurricanes Laura and Delta that took place last year. And now to have another storm coming, it doesn't take much to put everyone on edge. This morning, from a drenched Texas coast to an already storm-battered Louisiana bayou, millions are reeling from Nicholas.
We stayed in our house here, and it was shaking the whole night. It was unbelievable.
It was about a 5.5-foot storm surge.
24 hours after the storm made landfall in Texas as a hurricane, packing nearly 100-mile-an-hour winds, more than 100,000 people remain in the dark.
Our number one issue is power. That's number one.
As cleanup and electric crews got to work in Texas's hard-hit communities, Nicholas turned toward Louisiana, a state still hurting from the loss of life and devastation caused by Hurricane Ida.
We got about 9 trees down, 2 power lines that's messed up. The main thing is we don't have no electricity, and we're going on, I think today's the 15th day with no power, no electricity.
President Biden approving the Louisiana governor's disaster declaration before Nicholas even arrived.
This authorizes FEMA to coordinate disaster relief efforts across 64 parishes.
In Lake Charles, the scars of past hurricanes impossible to miss. Whatever Rachel Wiley didn't lose to Hurricane Laura, she did just weeks later to Delta.
Has it really felt like one right after the other?
Yes. Yes, it has. You can't give up. When you have kids, you can't show them that you're scared.
The path of Nicholas at times erratic. Now forecast to move across Mississippi, Alabama, and the Florida Panhandle, with almost nonstop rain, proving this storm is far from over. And this morning, those flood watches already extending into the Florida Panhandle. In the meantime, the state of Louisiana announcing more than 70,000 households now qualify for that blue tarp program from Hurricane Ida. And we still have 2.5 months to go in hurricane season. Joe?
All right. Thank you, Morgan. Let's get the latest on Nicholas and a look at your morning news now weather.
Which means it's time for Bill Cairns to join us. Hey, Bill, good morning.
Hey, good morning. Good to see you guys. And, let me show you Louisiana over the last 2 summers with hurricane season. And it has been relentless, as Morgan was just mentioning in his story. So in 2020, last hurricane season, we had 11 U.S. landfalls. And you look at the northern Gulf Coast, Laura, Delta, Zeta, Cristobal, Sally was right there, too. And then if you add on top of it, this season, we've already had 8 U.S. landfalls so far. And once again, we're peppering, with Ida there and what we just dealt with Nicholas, we're peppering the northern Gulf Coast again. I mean, the east coast of Florida and the Outer Banks of North Carolina are typically the spots that get hit the most, not the last 2 hurricane seasons. So what's left with this season? Well, usually we get 3 landfalling systems a season. We're only about halfway through it. So technically, we probably should see at least 1 more, maybe 2 more landfalling systems in the next month or 2. So here's what's left of Nicholas. It's still drifting through Louisiana. Overnight, we had some really heavy rain around New Orleans. That's now shifting east a little bit. And this is just going to kind of, slowly drift and just dissipate. But the rainfall from it's going to continue. We still have 6 million people in flash flood watches. We have 1 flash flood warning north of Slidell, Louisiana, the northeast corner of the state. And anyone driving on I-10 today, that's going to be some of the worst conditions. Maybe another 1 to 3 inches of rain. So isolated flash flooding, isolated totals possibly up to about 6 inches. And everyone's already saying, what's next? Well, we do have a system that looks like it's trying to develop just to the northeast of the Bahamas. A 60% chance this one does become a tropical depression. The good news with this, it's going to be close, but this looks to stay just off the east coast and head out to sea as we head throughout the upcoming weekend, guys. So, yes, it's been a breathtaking and relentless hurricane seasons 2 in a row. But at least for the next week, I think we're finally going to, we can kind of sit down a little bit and try to clean up.
All right.
Yeah,
well,
we're going to will that one system to just stay
away
out of the ocean.
Yes. Anything to give the South a break. All right, Bill. We'll see you in a little bit.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.